Today we have Dr. Neeraj Goel with us, a renowned doctor and specialist in GI Onco, Delhi. So we are going to start with our podcast today. So first of all, we all like to know, sir, what is pancreatic cancer?
Pancreas is an organ which is behind the intestines, behind your stomach, and this organ is mainly functioning for digestion of the material which we are eating. Second most important function is your insulin production. So blood sugar control is its main function. Any tumor, any uncontrolled growth which is occurring into this pancreas is a pancreatic cancer. So the definition is straight. Anything which is into pancreas, growth into pancreas is a pancreatic cancer.
So what are the causes of pancreatic cancer, sir?
If we just tabulate the causes, first is I would say lifestyle related. The most important one is smoking. Second comes alcohol. There are certain reports that excessive coffee intake also increases the risk of the pancreatic cancer. Chronic pancreatitis is a condition in which your pancreas is getting inflamed regularly and chronically. That can also give rise to your pancreatic cancer. And another last thing in pancreatic cancer I would say is hereditary. There are certain cancers which are pancreatic cancers which are running into the family. So these 4 or 5 are the main causes. I would say that majority you can understand that your smoking, your coffee, your alcohol we can change. So I would say if you are able to decrease all those intake, maybe we are able to reduce the incidence of pancreatic cancer.
Sir, as you have mentioned that it depends on the caffeine intake and the smoking. So I would like to know, like India is a culture mix. So what is how common it is in the India that pancreatic cancer can cause to depending on men and women?
If we just see the incidence, I will not be able to give the absolute number, but if we see the incidence, it is more or less equally distributed in males and females, slightly higher in the males. Maybe due to increased alcohol intake, which is leading to chronic pancreatitis, or maybe increased smoke percentage into the males. But more or less, it is equally affecting both the sexes, slightly more towards males. And I would say it is not an uncommon cancer in India. Every now and then we frequently encounter these kind of pancreatic cancers. So it's very, very, I would say, common to see such cancers in India.
Okay. So how would we get to know what are the signs and symptoms of this pancreatic cancers?
Pancreas is an organ, I said that it is behind your intestine. Into the pancreas, your bile duct goes from your gallbladder and your pancreatic duct join over there. So you can understand if there is something which is increasing into the head of the pancreas, so it will compress upon you to a bile duct, so it will cause jaundice. So the most prominent symptom in a case of pancreatic cancer, usually we call it the head of the pancreas, is jaundice. Second is pain. I would say approximately 60-65% of the patients of pancreatic cancer will be having pain. Pain is usually in your central abdomen and can radiate to the back. So these are two prominent symptoms. Other symptoms would be you might feel not like eating, means you are having anorexia. You may have weight loss, and the other symptoms would be when the tumor has grown big in size. It might compress upon to the intestine, leading to vomiting after meals. You have eaten some food and then you vomited out. So these are 4 or 5 major symptoms of the pancreatic cancer. We should keep in mind a pain in the central abdomen which is radiating to the back is the foremost symptom of pancreatic cancer, followed by or almost equally jaundice.
Alright. And what are the diagnosis and testing of this pancreatic cancer?
First thing first, I should be keeping in mind the symptoms. Whenever this symptom happens, go to your doctor. The first investigation doctor will get, you are having jaundice, so it will be liver function test to confirm the jaundice and what is the magnitude of the jaundice. 10, 12, 10, 12, 15, whatever it is. Second investigation which is called upon is ultrasound. Ultrasound of the abdomen, it will show you that there is a mass lesion, there is a growth into the pancreas, there is obstruction to the bile duct, there is dilatation of the bile duct, and certain lymph nodes around. This is the primary investigation. When we see that there is a growth into the pancreas or there is some bile duct compression, bile duct dilatation, then the next investigation comes as CT scan. CT scan is usually a special type. We call it as triple phase CT scan because it sees blood vessels accordingly. It becomes very important for me. CT scan is for the staging. It is for the clinical staging, whether my disease is spread to other organs or not, and whether it is encasing any vessel or it is adherent to any vessel. So CT scan is the most important investigation. Another investigation is pancreatic, I would say for pancreatic cancer is PET CT scan, positron emission tomography CT scan. I always, as my personal opinion, I get a PET scan with a triple phase CT. Because this is one investigation which is going to show me my tumor and it is going to show me any spread into the distant organs like your chest, your lungs, your liver and anywhere else. So the single investigation is PET scan with a triple phase CT scan, and importantly I should be commenting upon tumor marker. The important tumor marker for pancreatic cancer is CA19-9. CA19-9, we complete abbreviation would be carbohydrate antigen 19-9. This is a marker which gets increased in your pancreatic cancer. So whenever you are seeing a mass lesion into your pancreas and your C19-9 is raised, so it is more or less it is a pancreatic cancer. So just to summarize, the main investigation is ultrasound of the abdomen followed by CT scan, or better would be PET scan with a triple phase CT.
Thank you so much, sir, for guiding us that these are the options that are available for diagnosis of the pancreatic cancer. So we would also like to know what are the treatment plans that we can go in this type of a cancer.
The treatment of pancreatic cancer is surgical. The primary treatment is surgical. If I am able to operate upon my patient upfront that my tumor is very much operable, I take the patient up for surgery. Sometimes it happens that I am having jaundice, the patient is having jaundice. So in that scenario, you don't operate upon the patient straight away. In that scenario, you have to do an endoscopic ERCP, we call it as, so that you put a stent into the bile duct, your jaundice decreases, then you take the patient up for surgery. The surgery remains Whipple's procedure, we call it as Whipple's pancreaticoduodenectomy. It is a big surgery, around 5-6 hour surgery. That is the primary surgery for the pancreatic cancer. Major should be commenting upon the major means of this surgery is open surgery. That is जिसको हम हिंदी में अगर बोले तो चीरा विधि द्वारा जो हम बोलते हैं. But it can be done robotic and laparoscopic also. The best results have been seen with open surgery, so majority of the people recommend open Whipple's pancreaticoduodenectomy, but can be done laparoscopic and robotic. So this is the main treatment for the pancreatic cancer. Because it is a cancer, I remove the cancer, the report comes to me, we call it as a histopathology report. According to that, the staging is done. Majority of the patients of the pancreatic cancer would be requiring chemotherapy after surgery. So you operate, then the patient goes for chemotherapy. I should also be adding one thing over here is sometimes it happens that your tumor is not conducive for surgery. So these are the patients in which you have to give the chemotherapy first, reduce the size of the tumor, and then take the patient up for surgery. So ultimately my aim is to make my patient fit for surgery so that I can remove the tumor. Surgery is the main treatment.
Sir, average how many days it needs for the recovery of the patient that undergoes the surgery?
If we just talk about surgery, I admit my patient one day prior to surgery. Next day you are getting operated. Everything going fine. The patient is discharged on 5th or 6th day of the surgery. So your hospital stay would be 6 to 7 days. And when you are getting discharged, the patient is getting discharged, he is usually taking soft diet, means दलिया खिचड़ी वो आराम से खा रहा होता है. And by the end of another 2, 3, 4, 5 days, patient is able to take normal diet. And we have seen that our patients within 2 weeks, they are doing perfectly fine. They are as good as they are before the surgery. So my recovery period, I would say, it is somewhere around 7 to 10 years.
So as this is a critical conditions, like it make people like it is unnoticed cancer. So what are the lifestyle changes that we amongst healthy people can bring to them, so preventing this type of cancer?
You answered yourself that you require lifestyle changes. So lifestyle changes is you have to shun smoking, you have to stop taking alcohol, decrease the intake of coffee as much as possible, don't be a couch potato, take good amounts of water and do regular exercise. By doing these lifestyle changes, majority of the pancreatic cancers we can prevent. Hereditary, obviously I cannot do much for it as of now. If it is there in the genes, obviously that thing is going to occur. But majority of the cancers can be taken care by taking a good lifestyle, as we just.
Thank you so much, sir. This was an informative discussion, and we could understand what are the cause, symptoms, and prevention, and what are the lifestyle changes that could be given to us, and we all can adapt that lifestyle to prevent from this pancreatic cancer. And at last, I would like to say, if you have any queries, you can comment down in the below. The next topic will be food pipe cancer. Stay tuned and please like, subscribe the channel and stay tuned for more podcasts.